So every second Saturday, we go to one of the local HEB stores and give out around 200 books and some parent tips, encouraging folks to read with their children, count with their children, play with their children, think with their children, and dream with their children.
Bright by Text, it really is a force multiplier for our families, giving them the ability to have the tools they need without having to search for it.
Public health has no borders. Regardless of your background, we want people to know that they can come and access the resources that are available to them at Laredo Public Health for any one of their health concerns that they may have.
Good morning and welcome to the TAMIU campus here in Laredo, Texas. I'm your host, Lance Kelly. I'm here joined this morning by Dr. James O'Mara, the Dean of College of Education at Texas A&M International University. Good morning.
Good morning. How are you, Lance?
I'm well. How are you?
Very well. Welcome to Laredo.
Thank you. Thanks for having us.
Wow.
More excitingly, we're going to talk about your interview series titled Fertile Grounds. Can you tell us a little bit about why you chose this name and how it reflects the goals and the vision of Laredo being recognized as the best city to be born in Texas?
Absolutely. So when I came down to Laredo, I'd ask people, where did Laredo get its name?
Mm-hmm.
And there was lots of different definitions. Oh, it's about Laredo, Spain. It's a bird. But actually, there's a translation which says Laredo means green pastures.
Mm-hmm.
And I really think when the founders of Laredo walked along the Rio Grande, saw the ground, and thought, this is fertile ground. This is green pastures. And so I started to think about that in terms of, well, what if we started to remind people that Laredo was a city and is a city of fertile grounds? We often think about trucks,
Mm-hmm.
the heat,
Mm-hmm.
but no one thinks about Laredo as fertile grounds. And it's time for that to change. Laredo is a city, has 2 A-grade school districts, highest concentration of blue ribbon schools per capita in Texas, #1 community college, and a nationally ranked university in terms of social mobility. Now that sounds like fertile ground to me.
Yeah. All in a population of 250...
276, 300,000.
thousand people. That's rich and fertile.
Absolutely.
From an education standpoint. So as the Dean of College of Education, how do you view your role in serving as an agent of change for the people of Laredo? And how does this mission influence your approach to community engagement?
TAMIU, or Texas A&M International University, is a regional university. And so as a regional university, we have a compact with our community to make a difference, to be that catalyst, to ignite the sparks and unleash the potential of the community. So as a dean, my job was to understand what the community needed and then find the people and the talent to unleash that talent. As I said, the fertile grounds for talent is here in Laredo.
Mm-hmm.
So when we started to look at it, our schools are doing great, our community college is doing great. Where's that gap? And it was the preschool and after school. Before children get into school is where we can make the biggest difference, where we can be that agent of change. And so that led us on this journey of Laredo as fertile ground. Why the best place to be born in Texas? Because Texas is focusing their early childhood or pre-K, 0 to 3, initiative is around making Texas the best place to be born. I think Laredo can really be that city that stands out as the city where you can have a healthy start in terms of mothers and babies, a strong start in terms of getting ready for school. So by the time they turn up in day one, they're physically, emotionally, socially, and intellectually ready for school. And that's what it's all about, school readiness.
Mm-hmm. So going deeper into the population from a pre-birth standpoint and how you're amassing some of these relationships and your community partners, right? That's a key aspect of your college's
Absolutely.
work. So can you discuss how the College of Education collaborates with some of these local organizations and what impact these partnerships have on the community? Just this morning, we've already spoken with the chief of police here on the campus. We've spoken with somebody from the City of Laredo. So you've got a lot of partnerships. So talk a little bit about that.
Yeah, one of the superpowers of Laredo is the concept of juntos. Now, some people think about that as collaboration. But really, it's further than that here in Laredo. It's a stewardship. The city comes together to look after its future because they're the youth that will shape our future. So we start to look at the key stages. The first one was healthy birth. Mm-hmm. So we work with folks like Reynol and the Bright by Text to get parents connected. As soon as they know they're expecting, get connected through Bright by Text.
Connected and educated.
Connected,
right? Here's what
and
to expect
absolutely.
As you're expecting.
As the textbook says.
Yes, it does.
Now, another great initiative is one of the local hospitals, the Laredo Medical Center. They implemented a brain bag initiative. So every baby that's born receives a brain bag, which is packed by the local volunteers of the hospital. And instead of getting diapers and all the other stuff, which they still get and very important,
right,
they also get a book and tips on how to and why it's important to read. Mm-hmm. So this year alone, we'll be on track for 10,000 books over the last 2 years, because we know roughly 4,000 children are born each year in Laredo, and 80% of those are delivered at Laredo Medical Center. So that's why we partnered with LMC for this great initiative. We've partnered with the city. So the city, not only the health department, which Reynol, and you'll also meet Richard through the series, but the mayor and the councillors, they advocated for little libraries across the city. So our goal is not only to be the city of 100 parks, but also the city of 100 libraries. And their sponsorship is, in terms of support, is making that very important. The sponsorship comes from the Mexican Consul General in Laredo. So he helps fund the little libraries around the city. His initial one was at the Mexican consulate. So when you come across from Mexico, the first thing you see in Laredo is this is a city that learns. This is a city that takes care of its youngest and provides opportunities, fertile ground for success in future life. We also partner with businesses. You'll meet today in this series, Memo Trevino, a local business owner who has a library in his place. So the people who can't get to a library can take a book, take it home, and then bring it back. Books become the currency of this learning city we call Laredo.
Wow, that's impressive and far-reaching.
Oh, absolutely.
So the college provides opportunities for service learning and community engagement. How do programs like the Ventanilla de Orientación Educativa, little libraries that you just mentioned, and the HEB literacy events contribute to the college's goals and benefit Laredo community?
So our Little Libraries initiative, which links into the Ventanilla project as well, or the VOE, Ventanilla Orientación de Educativa, our students actually help pack and distribute the books. So they're learning about the importance. Student engagement, very important, having that impact. We also want to make sure that we go to where the families are. Not everyone can come to TAMIU. Laredo is a compact city, but there's different neighborhoods, and for some people, the university is just a world away.
Right.
So every second Saturday, we go to one of the local HEB stores and give out around 200 books and some parent tips and bookmarks, encouraging folks to read with their children, count with their children, play with their children, think with their children, and dream with their children. We also partner with local businesses who have billboards and on the bus stops, signage, reinforcing that same message. So when people come to Laredo, and I encourage folks to visit us, rather than see what's on the news, actually see what's in action in the city. And you'll see a city that is fertile ground with a great community coming together to make sure that our kids are ready for school day one.
You're making it hard to miss, right?
That's it. It's just a way of being. It's not a slogan. It's not a tagline. No. It's a way of being. We say we learn to live and we live to learn here in Laredo.
Yeah. Let's go back to student involvement because you mentioned that earlier. Yeah. So how does the College of Education facilitate student participation in service learning activities? And then what are some examples of successful projects or initiatives that have made a positive impact on both students and the community? So let's dig into that a little bit.
Absolutely. So again, the HEB literacy events is a great opportunity for our students to prepare for their career as early childhood educators. We learn a lot about the hard skills and the knowledge and the tests. But engaging with parents, engaging with communities is something that's often hard to produce.
In the classroom.
In the classroom.
In the classroom, yeah.
So imagine every Saturday between 11 and 3 o'clock, every second Saturday, I should say, there's 5 or 6 volunteers. We have 2 who are greeters, and they greet people coming into the stores and talk about a scavenger hunt. So we turn the supermarket into this classroom where they can see letters, find colors. And then 2 roamers. So just in case we miss someone, HEB is a great partner. There's a backpack. There's some books. They can take a free book home every month, a different book. And they also get a backpack as well. So they can really enjoy and connect with the supermarket and start to think of it as a learning destination and a fun way to be. So that's one example. And the other example...
And these are all, let me interrupt you, these are all students
Absolutely.
who are doing this every second Saturday at the HEB, the greeters, the facilitators, the closers.
The closers,
The
So they
at the
close the event.
Yeah.
Yeah.
So
And the
those
way
are
they
all
check-
student engagement. They're actually getting out there in the community, engaging with the folks, making
And the
sure that
parents
the kids are having
in
fun.
English and Spanish, and this is another part, is a dual language community. It's a great opportunity for them to practice connecting with parents, especially in the neighborhoods where we work are typically Hispanic neighborhoods. And so learning to connect not only through the head in terms of ideas, but connect through the heart with the language. That's an important piece which they pick up, which is very difficult. You can read a textbook, you can practice your verbs, but to actually communicate and connect with a parent in the community, very different.
All right. Any other examples?
Well, the other example, we're working with another group called Project Elite. So it's Emerging Literacy
Project Elite. Okay.
And ELITE is an acronym, Emerging Literacy in Teacher Education. So we're building the capacity of our early educators to increase their effectiveness as early literacy educators.
Okay.
So this is a 2-year project, again, with our early childhood folks. They're working with the school district, so another partnership. What do young children need, or what's the gap between school readiness and when they come into school? The schools do an amazing job. When they come into the start of the year, there's an assessment, and the readiness levels have room for growth. By the end of the year, Laredans children are actually at or above state level. So we're really looking at that lift. What can we do from 0 to 3 to reduce the lift for the school?
Right.
So partnering in this Project Elite, we're learning what's working, where we need to strengthen. And then we're also using this really nice piece of technology called mixed reality simulations, where they can rehearse connecting with parents, teaching young children reading in a safe environment to increase their effectiveness and the impact on the early years. So there'll be a family literacy night where they're going to work again with parents, teaching them how to use translingual books. In other words, English and Spanish. It's not one page English, one page Spanish.
Right.
It's a blend, and that's really what happens here in Laredo. There's this beautiful dance between English and Spanish, whatever's needed to connect and communicate with the person you're talking to.
And making that feedback loop constant, right? So these programs are continually evolving, continually improving. I'm hearing a theme of making it easy for that day one of school in kindergarten, right? Because you've done all the homework ahead of time from 0 to 4 or 5 years old, so that.
Well, if you think about it in terms of fertile grounds, you've
planted
worked
the
ground,
Yeah.
you've worked the ground, you've planted the seed, and these daily activities is really cultivating, watering, and ensuring that there's a strong foundation for success in school.
Yeah. So let's look ahead. So what are your goals for expanding the college's involvement in community programs and partnerships, such as the Abu Academy, right?
Yeah.
Which is short for Abuela, which is
Abuela, abuelita.
Abuelita. Okay.
So we're looking at the idea that in Laredo, everyone's an educator. So we talk about teachers, the K to 12 teachers, but 2 out of 3 children, their main teacher in those first couple of years is either a friend, a family, or a neighbor. So when we talk about catalyzing or being that catalyst, we've got to unleash the potential of the friends, families, and neighbors. And one of the main groups is the abuelitas,
the grandmothers.
the grandmothers.
Yes.
And so what we're looking at is a fun academy where it'll be connecting through art. So draw with your children. So they'll come and do a course with a local instructor. They will, then their homework is actually going home and drawing with those children through an activity book. And then they'll graduate with a certificate of participation from the Abuelita Academy. We say they're the third act educators.
Yeah.
In my world, the first 20 we learn, the second 20 we earn, and the third 20 we return. And this is the third act. This is
The
when
return.
we're returning back to the
Mhm.
community and just building that strong foundation for the future of Laredo.
That is very important, because there are times when that family is working one or two jobs, or that parent is working one or two jobs.
Absolutely.
And abuelita is there to take care of them for a couple of hours a day. And so learning.
And
counting-
sometimes even raising, you're right, there's sometimes a 2 or 3 shift family, or the brothers and sisters. This is another one that we're looking at eventually, is that
Let's talk about that.
Yeah, in a typical family, there's probably 2 or 3 brothers or sisters that'll serve as that parent, educator, carer, responsible adult at a very young age. So again, as a catalyst, how do we harness and unleash the potential? How do we equip or empower those educators to be that change maker in their home, one house at a time, one neighborhood at a time? And again, closing the gap by filling the gap. In this case, it's preschool and after school.
These are all the farmers tending the field, if you will.
That's
to go back
it.
to your analogy of making
Absolutely.
sure that it's
They're the
planted, fertilized,
cultivators.
watered, cultivated, right? And so the farmer could come in different shapes and sizes, right? It could be a brother, it could be a sister, it could be a grandparent, it could be a neighbor.
Yeah.
But everybody's got an involvement in that child's development and upbringing.
And that's where we work. It's really a cooperative farm, if we keep going down the farm analogy, because what we discovered pretty quickly, even if every child wanted to go to preschool, this just simply isn't the spaces. Around 50 to 60, say 2 out of 3 children are probably in those first couple of years with a friend, family or neighbor. So let's build that capacity. It's a new form of teacher education for the parent and sometimes the abuelita or the abu, because they are your first educators. Then we start to think about also these book deserts. So again, in many communities across Texas, around 2 out of 3 children won't have a book at home. That's why we give these books away at the supermarket. So we give the resources and the strategies or skills through Bright by Text, through the handouts that we give out, so we can have the best and most effective educator workforce after school and before school. Abuelitas, brothers, sisters, friends, family, neighborhood. The trust, the people that those parents entrust with care, but more importantly, those quality learning experiences before and after school to set that child up for success.
So you mentioned book deserts. Let's talk
Yeah.
about that for a little bit, and any existing initiatives or desired initiatives to eliminate book deserts. And to your point earlier about not everybody's right down the street from an HEB. Some people are a little more, or they are further out on the outskirts of town, and maybe have a challenge getting into town because they're working on their farms or wherever they are.
Absolutely.
So talk about the book deserts and any initiatives or thoughts around eliminating those book deserts.
It's a 3-pronged strategy. First of all, the books. And so again, working with supporters, such as our friends at Laredo Learns, and you'll meet Memo. He basically supplies 10,000, he supplied the 10,000 books. And so ironically, and this is a great Laredoan story, the books come from HEB down to his warehouse, and then I'll pick them up and we bring them up here. And then our students on the table out there will do a packing party, because the books all come with a single title.
Right.
So you mix the books up. We take them down to the supermarkets, but not everyone goes to those 2 supermarkets. This is where the little libraries come in. So the little libraries are around, well, what can we do and how can we make sure that a library is within access, either in a workplace or in a community, safe community space, a park, a City of Laredo facility where they can pick up books. Even the Laredo airport now has a mini library. So
Really?
when you leave today, have a look for the little library next to the check-in counter there to send that message that you can take a book and circulate those books around the city and hopefully around the state and beyond.
And have an impact beyond just the state. I mean,
Absolutely.
beyond
Well, that's
city
what
limits
Laredo,
and the state limits.
Well, it's fertile grounds. And so then the last piece is the strategies. So we've got the books, the library network, and then the strategies.
Okay.
And so the strategies we give out with our handouts, but we also have bookmarks that we put in the books, which has a QR code to the strategies, how to read to a 0 to 2, how to read to a 2 to 3, 3 to 4, and make it fun. There's no right or wrong way. If you can make a memory, you can make a difference.
Just do it.
Just
right?
do
Just
it.
take the initiative, do it, take action, engage.
Yep.
Don't kick the can down the road.
And you can see it. Like the most beautiful memories. I probably go to most of the HEB events. I stay there for about an hour. The students are now just they're great leaders. They make it happen without me being there. And it gives me a chance to walk through the store. And when you see a parent, a father, a mother, little pointing and talking, connecting, making that connection, that's what it's all about.
Carrying those lessons through the store and ideally throughout their development.
Well, they take the book. There's a bookmark they take home to color, and so then they can take that back. And then I think my record so far is eight children around a shopping cart. So the mother was there with 8 scavenger hunts, and that's sort of the impact. So we think basically with the number of books and the number of people they contact, it's about 700 contact points per Saturday.
Yeah.
So you multiply that by 2 Saturdays a year, by 12 Saturdays 2 days a month, by 12 Saturdays a year. The message is starting to get out.
Good.
And if you don't go there, look at the billboards, look around the city. You can't miss that Laredo learns.
Yeah, it's there for the awareness, right, of your community. Is there anywhere else where folks would go to find out more information?
Oh, that's easy. Just visit the Laredo Learns website, and all the information you need, you can find it there.
All right. And can they engage on social media as well?
We have the College of Ed does have a Facebook page.
Okay.
And again, College of Ed Facebook page is a great place to keep up with the events, where things are happening, and how you can get involved.
Dr. Omar, is there anything else you want to talk about?
No, I think
Did we cover all the?
I think we've covered all of the points. Just as a reminder that Laredo is fertile grounds, and with the community support, we're well on the way to becoming the best place to be born in Texas.
I love it. Great. Dr. O'Mara, thank you for talking to us this morning about fertile grounds here in Laredo, Texas. I'm Lance Kelly, your host, joined by Reynol Vela, who is with the City of Laredo and a project called Bright by Text. Good morning.
Good morning.
How are you doing?
Doing fantastic. I'm very, very happy to be here.
Well, we're excited to
thank
have
you.
you. We're excited to have you. So tell us a little bit about your role within the City of Laredo and the Bright by Text initiative.
Certainly. So I am actually a nurse supervisor with the Public Health Department here in Laredo, Texas. For those that might not know, we're here in South Texas, way, way, way on the border. So my role as a health department employee is to supervise our nurse family partnership program. This is a program we've had since 2012 that provides services to first-time mommies. And the reason I share this story is because that is how we came to have Bright by Text. Bright by Text is actually a national service available throughout the country. And it is a way for families and anyone really with a child in their lives to be able to connect with that child and build skill sets. So the way that we came about it at the health department is through our grant, Texas Nurse Family Partnership. We were offered the opportunity to explore this program, really see if it would be a benefit to our community. And from the moment we were able to test it, see it, how it worked, we loved what it did for families. And so we then were able to jump on as an administrator locally to develop local content and build the messaging around Bright by Text. So that's kind of how I ended up in this chair today.
That's what you do for the city. So tell us a little bit about it. What are these text messages that these families are receiving?
Yes, and so this is a beautiful service. It is completely free to anyone in the community and really anyone in the Texas region, in South Texas, in Webb County, and Laredo, which is where we are.
Yeah.
And the way it works is they sign up to subscribe to receive text messages. These messages are free, and they happen about every couple of days in a week. And these messages have content across a range of different topics in the early childhood space, from pregnancy to how to be a better parent, how to make sure to build that developmental milestones for your child. So it's not just for parents, even though that's mainly one of our major audiences, but it's literally for anyone who has a child in their lives. We want to implore our community to come out and subscribe to the service.
Yeah.
The best thing is once you subscribe, there's no further action needed. It's really one of those things that once you do it, it's a gift that gives on giving.
Yeah.
And that is quite literally the statement of Bright by Text.
Wow.
It allows for our families to receive messages as early as pregnancy through that child's 8th and 9th birthday. And during this entire time, the content they receive comes from Sesame Street, from PBS Kids, all of these different providers that are able to empower that family, that individual with a child in their lives. to be a better in the role model for that child and to help build their skills. We can think of messages across a range of topics, from how do I make sure baby's having a fun time? How do they build their brain? To once we have school-age kids, how to deal with those school-age problems, how to deal with navigating the world of becoming a preteen in your 8 and 9 years old. So it's content that is continuously building on itself. So that's kind of the program in a way.
Awesome. That's tremendous. So talk about how the Bright by Text is addressing some of the unique challenges that families in Laredo's need to address.
Yeah.
And you teased us here with a little bit of the preteen. So what are some of the other things that are unique and challenging families that Bright by Text is helping?
Yeah. And so this is a wonderful question, because we really get to explore what it is to be a family in 2024. When we think of family structures 10 years ago, 20 years ago, even 50 years ago, we think of that nuclear family, that family where mom and dad are there 24/7 for that child and helping them navigate the world. Now, our families in both our community and throughout the United States, the structure is very different. We have single-parent households. We have multi-generational households, especially in Laredo. We think of our grandparents raising some of our kids. And so these are all challenges that make it more difficult to be a childcare provider and a parent in today's society. Come to think of it, we're also looking at as well navigating the world of busy families. Nowadays, it's not surprising for a parent or a caregiver to only have a few minutes a day to really get to connect with that child, even in their earliest years. And so how do we empower our families to really get a good start for that child? How do we empower that family to maximize their time while they're navigating 2 jobs, 3 jobs in our community, maybe navigating not being able to have the funds to buy groceries. So we're not having families that are solely dedicated to just raising that child. Sometimes they're just trying to survive. And that's something that is acceptable. And it is true for many families. So Bright by Text, it really is a force multiplier for our families, giving them the ability to have the tools they need without having to search for it. I'm a parent myself, and I spend so much time going, where can I take my child this weekend to have fun? Where can I take him that's not going to cost an arm and a leg, so to speak? And Bright by Text shares with me, even though my kid's already older, it shares with me the resources in the community, like the library, public parks, community events, that are all free. And that's something we want to appreciate as a family member. And we want to know that up front. We don't want to have to go and see the news and be like, oh, this event happened yesterday.
We missed it.
I wish I was there.
Wish I would have known about it.
Exactly.
Yeah, we could have gone.
Yes, and so this is the beauty of Bright by Text. It gives information right to your phone, right to your phone where you can take action. And it's not just about the events. It's not just about the programs. It is really and truly, how can I help my child succeed? And so you don't have to read 20 textbooks on early childhood development to do a good job as a parent. You can sign up for Bright by Text, and these messages come straight to you with simple little information that you can read right from that text message, and a link to other resources. So we can click on that link and we might see how to prepare our child for the summertime heat. We can see a link that will show us how to do a fun activity at home with pots and pans. We don't have to be buying those expensive toys. And Bright by Text empowers our families to really make those choices.
That brings me to my next question. So what are some of the key programs or messages that Bright by Text is using to promote healthy pregnancies? So going back early in childhood, early childhood health, and then overall family well-being.
Yes. And that's one of the other beauties of Bright by Text. This is not a static service. This is not a static item that is one time and forget. This is something that grows with that family day in, day out. In a perfect world, that pregnant mom is signing up for Bright by Text and getting messaging on how to be safe for herself, how to be safe for baby, and how to really navigate the world of pregnancy. And it doesn't stop there. Bright by Text then continues. It continues through that child's first birthday, through that child's second, third, fourth, fifth birthday. And it develops with that child. The information is not just a one-size-fits-all content.
So it is specific to
It is,
where
absolutely.
that mother is in the child's development stage. Oh, that's interesting. So it's
Yes.
not a general program, but it is a program specific for where they are in their life. Okay, that's
Yes.
all right. Keep going, please.
And so this empowers our grandparents as well, our families. It empowers school teachers. It empowers anyone with a child in their lives to really see content that is appropriate to the age of the child. I've had this service since about 2018, 2019. And my, at the time, fake baby that I created to kind of test it out, see how it worked, see if I liked it and if I wanted to actually speak for this program.
Right.
The messages have been fantastic. My imaginary child that I created this profile with is now about 5 years old, and the content continues to amaze me. It is content that is always helping me understand the world of a child, how they can better play, better build that partnership with that child and with the parents.
And help
it
them
also-
stay one step ahead, if you will, right? Because
Yes.
sometimes we're on our heels. What do I do next? But it sounds like we're in age appropriate, time appropriate, and developmental appropriate information that's coming through your program.
Yes.
That's fantastic. So go back to preterm births, right? Because they're a significant concern here in Laredo in early childhood. How is Bright by Text contributing to initiatives that aim to reduce preterm births and support infant health in Laredo?
Sure. So in this area, Bright by Text has the wonderful capacity to be able to help our families from all age ranges. And you might be thinking, how would someone with a 4-year-old benefit from this? But the way is, it's building the knowledge that a parent can have. And as well, with the community side of it, the community messaging, we're able to really give information to our families about services that are available in the community. So that pregnant mom will not just get content from Sesame Street. It won't just get content from PBS Kids, but the content will really be coming from our local community. So when they're looking around and going, where can I get healthcare services? Where can I have a healthy pregnancy? That's where that local content comes in. That's where the content that I help administer helps to bridge that gap. So it allows our families to access local services that they might not otherwise know of or be really able to access without having to do a lot of research.
That brings me to my next question, which is how are you collaborating with other city departments and community leaders to ensure that families are aware of the information and how they should best receive it?
Yeah. And so this is something that we've done since we started with the Bright by Text program about 4 years ago. It has been something where we're not looking at just one organization, just one agency. We're looking at the community. So one of the ways we've done this in the past, for example, is we realize parents work. So what better way to really reach our parents, reach those that take care of our children, than to work with employers? So we've worked in the past, for example, with the City of Laredo, with Webb County government, to be able to promote that through their employee wellness programs and through their HR divisions. So that way, this message of Bright by Text and the wonderful work it does really reaches these families. At the same time, we work with our libraries, our Parks and Recreation department here locally to make sure that they're able to spread that message. And finally, one of the big ways that we do this is through our coalition work. Through the health department, we are able to connect with the Laredo Health Coalition through the Webb County Early Childhood Wellness Council and other organizations to be able to inform our providers of this service. That way they can inform their clientele, their participants.
Are there, I think there was an advertisement, a billboard maybe, that they could find some information, a website, phone numbers that are out there in the community to kind of capture the attention of those who may not be aware of it. Is that something that is part of the Bright by Text initiative?
Yes. And so through the Laredo Public Health Department, once again, we do social media advertising. So they can go to Facebook, look up Laredo Public Health. And through our Facebook posts, we send messages every now and again on Bright by Text and its wonderful services. They can also reach out to our national office. So Bright by Text has a national website, brightbytext.org, where they can visit. They can actually sign up for the services right there and then. And that allows them to be able to do so. And the best part is, because of our local goals, we're able to communicate that message through health fairs. So if you're ever going to one of these health fairs in the community, one of the beautiful things is you'll likely see a booth that says Nurse Family Partnership on it or Laredo Public Health Department, and they can find our information right there and then as they're shopping around for other services and resources in the community.
Got it. So a little bit of a personal touch, a social media touch, certainly through the city, and then billboard advertisements and things like that where they could find. So looking ahead, what are your goals for the Bright by Text initiative?
Yes. So our goals is to reach every family in Laredo. And we know that's a lofty goal. It definitely is with a population of 260,000. But our goal is to reach as many families because every life that we touch with Bright by Text, every family, every individual we help gets us closer to being in a society, in a world where our children are taken care of, where our children have the best start at being able to live their best lives. And we know that for many families, that's a struggle. For many families, that's not the case. So any way that we can empower and reach more families is kind of the goal for our efforts in 2025 and forward. One of the other things that we want to do and that we want to sustain is being able to continue to adapt to the needs of our community. One such service that we started promoting within the past few years is our Coffee with Cops strategy. Now you might be thinking, why would you promote an event like Coffee with Cops?
Coffee with Cops. Is that
Yes.
right? If I
Coffee
heard
with Cops.
Coffee with Cops.
And we think about it in our society, in the Hispanic culture, especially in Laredo, we hear our parents use, and I grew up with this myself, we hear a theme of pórtate bien o la policía te va a llevar, which translates to behave, usually in the supermarket, in the grocery store, or that police officer will take you away. So we're scaring our children and we're creating that generational trauma.
Yeah.
And so, as we look at how we can address these generational traumas, it might not be about how we raise our child. It might not be about how that child lives their healthiest life. But if we can bridge that gap of that child no longer being afraid of police, that creates an adult that's not afraid of police. And so that's one of the many, many ways that we are targeting our local content to really solve some of the problems that are local to us that may not seem like an early childhood problem, but really are. So that's how we are striving to accomplish more with this service.
That is fantastic. One of the successes that you've built upon, is there anything else that you would say you want to take from the current success and build upon for the future?
Yes. One of the beautiful things about doing our outreach work, our health fairs, is talking to moms and being like, hey, you know what? We have this Bright by Text service. Would you be interested in signing up? And sometimes, every now and again, we'll have a mom that goes, hey, you know what? I signed up for that 2 years ago. And I love it. I love the content. It's really been helpful in navigating the world of taking care of that child. And so that really gives us the idea that this service is not just another service. It's not just something you sign up for and hopefully it makes a difference. It's making a difference for these families. And so that's what we want to do, is continue to expand that and to help bridge those stories of our families so that they know that this is something that isn't just a national product, that is a national brand. This is something that is local. This is something that makes a difference in the lives of our local families in finding the resources that they need locally.
Yeah.
So,
And even more importantly, or as importantly, it's specific for them and where they are. It's almost personalized, right? Not just generic. So for our audience, where would they go if you had to say they could go find some information and take action today? What are a couple of places where they should look?
yes. So the easiest one is they can text the word Texas Kids to 2744448. Again, 2744448. And that allows them to get their subscription process started. We'll just need the child's date of birth. We're not the police. We're not Social Security. We're not going to confirm that date of birth. So if you're one of those parents that doesn't quite know the date of birth, don't be afraid to sign up for the process.
That just helps. So let's talk about that for a second. The date of birth is important because it helps bring that parent or that expectant mother into your program where they are in that child's development. So maybe they haven't been born yet, so they don't have a date of birth, right? Then you're going to start with prenatal information.
Yes.
If the child is 2, you're going to start with 2-year-old information. Is that the way I understand the program
Yes,
works?
that's
why you need
right.
the date of birth. Okay.
Yes.
Where else would our viewers go?
They can also go to brightbytext.org. That's the national website where they can sign up. They can also give a call to the health department. Hey, we heard about this thing called Bright by Text. We're not quite sure what it was, but it sounded fun. It sounded interesting. I want to give it a try. You can reach any of our community agencies as well throughout the community. So if you're already receiving services, maybe at WIC, maybe at the library, ask about Bright by Text. There's a good chance they can navigate you to this service and help you subscribe. This is especially important for families who may not have that digital connection. They might not know how to navigate a cell phone as much, even though we take it for granted. They might not know how to go to the website to sign up. So talk to one of the agency leads at your organization that you usually visit. There's a good chance they can help you navigate to that as well. And at the health department, certainly we offer that as well.
And social media, where would they find you?
Yeah, so we do have both the National Bright by Text Facebook page, as well as our social media at the health department. So you can go to Laredo Public Health, and they can access our social media content there, as well as the Bright by Text content through Facebook by going to the National Service Facebook page.
Very good. Reynol Vela, thank you for being with us this morning. Thanks for talking about Bright by Text.
Certainly.
I'm here with Dr. Richard Chamberlain from the City of Laredo. Good morning and
Hello,
welcome.
Lance. Thanks for having me.
My pleasure. Glad you're here. Let's talk a little bit about your role at the City of Laredo Health Department. Is that correct?
Public Health Department,
Public
but
Health
nonetheless,
Department.
it
All
is
right.
health. My name is Richard Chamberlain. I am the Director of Public Health for the City of Laredo. I'm going into my 5th year as the Director of Public Health for the City of Laredo and have been in the public health realm for a decade. I've had rather of a meteoric rise to be at the level of leadership that I am at, and I'm very grateful for that. That just happened to be an opportunity that came about through the COVID pandemic, where my predecessor decided to retire 2 months into the pandemic. And we respect him very much for retiring 2 months into the pandemic, and that allowing me to come into the role as an interim and then ultimately be fully onboarded as the Director of Public Health for the City of Laredo Health Department. We're very proud about the work that Laredo Public Health does day in and day out for the members of our community, as it's part of our core mission to make sure that people know that public health has no borders. And public health isn't for a specific group, it is for all groups, regardless of your background. We want people to know that they can come and access the resources that are available to them at Laredo Public Health. For any one of their health concerns that they may have. And so Laredo Public Health is comprised of more than 40 foundational public health services and programs, with some specialized as well. And we are a very dynamic department, making sure that all foundational public health and services and programs are offered at Laredo Public Health, but we also have a primary care component as well. So we do ensure primary care at Laredo Public Health, which we are only one of 5 public health departments in the state of Texas that does provide that service.
Wow. So you oversee a lot of these programs, and by doing so, you're making Laredo one of the best cities to be born in the state of Texas.
Absolutely. We are working to ensure that health equity is at the forefront of all of our programs and initiatives, especially in the planning phase, to make sure that anybody born here is able to reach their fullest potential.
So let's talk about healthy births in Laredo. So can you describe some of the unique health challenges faced by mothers and infants here in Laredo?
For mommies in Laredo, it's difficult, especially within our lower socioeconomic status population, to access healthcare. We do know that we're on a better trend right now. A couple of years back, we were about 31% of persons living in poverty in our community.
Okay.
Now we're down, and that's something very good for the community, to about 24, 25%. But that's nonetheless, that's 1 in 4 people in the community who are living at or below the poverty level, aside from a third of our population who are under and uninsured. Throw in the medically underserved, the health professional shortage area, all those cause that challenge for mommies, first-time mommies, to make sure that they do have access to prenatal care and then, of course, postnatal care as well.
So with those challenges comes effort to promote programs, right? So can you highlight some of the key programs or interventions currently in place to support healthy pregnancies and healthy births?
I'd like to start off with our largest program at Laredo Public Health. Laredo Public Health operates the Women, Infant, and Children program, the WIC program. WIC is here in the city of Laredo and, of course, throughout the state of Texas and, of course, the United States as well. But we're very fortunate at Laredo Public Health that we not only manage the WIC program here in the city of Laredo and for the county of Webb, we also extend out into 7 additional counties to ensure that WIC is active and running and ensuring a healthy start for mothers, and then also for the children as they age through they age through 5.
Right. So beyond the city limits, you're making sure that these initiatives are going out further than the city community, right?
Yes, sir. Making sure that that healthy options for food items, just regular checkups are happening for mothers and babies. Aside from that, we also do have our Nurse Family Partnership Program, which is a wonderful program that has an RN, a registered nurse that visits you at home. And this is a beautiful program that can start off pre-birth and also post-birth up until the child's second birthday. And this enables an individual to be able to ask questions, to be able to have that guidance that's needed that might not be happening from a family member. And most importantly, the nurse is also able to do active surveillance. And that is what I find as a key element of the program for an RN to be injected, of course, with the permission of the participant into their homes, and have that expertise to be able to provide that coaching, to be that guidance. And not only, of course, just with the pregnancy element, but overall the health of the mother, that RN is also serving as a community health worker, making sure that those linkages and access to different programs that are available through public health or outside the fabric, but within the public health realm, to get her access to those programs and services. I can also add that we do operate the Texas Healthy Mothers and Babies program, which is an initiative that ensures that the community is aware of the programs that are, all the programs that are available, but also this program does coach first-time mommies or mommies to be, or existing mothers about how to install your car seat or whatever that may be. This program does ensure and champion those initiatives or specific requests for mommies in the community to maximize their knowledge and ultimately just elevate them overall.
So they are educators as well as nurses.
Correct.
Coming right to the heart of the matter, right? Which
Correct.
is pre-birth, making sure that they are taking advantage of the programs, making sure they're aware of the programs to take advantage of, and then making sure that they continue on to have a healthy birth. That's
Correct.
fantastic. So,
one other little element that I wanted to add, if I may,
please
is
do.
the importance of vaccinations for pre-birth, for mothers who are pregnant as well.
Okay.
Laredo Public Health is the champion and the pillar for vaccinations in our community, and ensuring that access to vaccines for under and uninsured populations are readily available. Of course, we do offer vaccines for our insured and self-pay populations as well. But as I mentioned, we want to make sure that everybody in the community has equal access to the resources that are available for them to reach their fullest potential.
Excellent. So then zoom out from the mothers for a second and talk about how you're working with other city departments and community partners to educate women and families about the importance of healthy pregnancies and some of the resources available to them.
So I have a couple of notes that I wrote to myself about this one. So I'm going to pull those notes out about the different programs that we're working to that are collaborative with the community partners. So I wanted to share that 2 years ago, we led an effort to build the Laredo Breastfeeding Coalition that brings partners together from across Webb County to help improve breastfeeding and other mother-baby areas.
Building that bond early, right? Connecting, nurturing.
Correct.
And most importantly, getting the baby the nutrition it needs. Yep.
Which is important. I mean, breastfeeding is a significant element in the healthy start. Of course, we do know that occasionally mothers are not able to breastfeed, or the baby is not able to take breast milk, few far and in between. But nonetheless, breastfeeding is something that public health overall does champion to ensure that bond, as you mentioned, is established, and ultimately that 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 the baby has the best outcome from all the different nutritious materials that are provided from mother to baby. We also do work collaboratively with community agencies to increase awareness on healthy pregnancies and early childhood to ensure that clients can reach programs that are available to them in the community. I'll go back to our immunizations program that has done significant work to spread the awareness and the risks from vaccine preventable diseases to stakeholders in the city. Our public information office has done great work to improve awareness of what healthy pregnancies should look like through a combination of approaches that include social media posts, press release, and other communications to the public. Our public health staff participate actively in a number of health fairs, community coalitions, and other collaborative spaces to promote healthy pregnancies. One of our major accomplishments is leading the effort to have businesses, community agencies, and other employers become Texas mother-friendly work sites. This one is very near and dear to me, as we did start this initiative via the Laredo Public Health Department. We do have a dedicated breastfeeding room that has its recliner, it's a massaging seat, it has the refrigerator, a sink, a lighting system in there. We wanted to make sure that it is very comfortable for mommies at the health department who are actively part of the workforce. And then if a community resident needed that's visiting us, patient participant that's visiting us that asked for a space, even though they are more than welcome to breastfeed in open areas of the public health department, we do have that space available to them. And we've seen that many new businesses and organizations have adopted this, have provided spaces for breastfeeding, or of course for mothers to pump while they're working.
Yeah, in private.
And
mostly in quiet areas, right? Where
Correct.
you can relax and focus on the
Correct.
task at hand. That's fantastic. Any other programs you want to mention? Other departments that you're working with?
Other departments, the City of Laredo has many other departments. We can go into community development or the fire department or the library system. They're all jumping on board as well to ensure that they do have spaces for their staff members and, of course, community mommies as well that might want to use these spaces. So we're very happy that the City of Laredo, as an organization and not just the Laredo Public Health Department, is on board with this initiative to ensure that they have, or that they are, a Texas mother-friendly work site.
Yeah. So looking ahead, what are your aspirations for the healthy births component?
For healthy births, it goes back to us being able to still have a better status or better purview of the data that's available to us. So with public health, we're data driven, and we want to make sure that we continue to include these elements into our community health assessments, our needs assessments, our public health risk and threat assessments, as healthy mothers, healthy pregnancies, healthy babies are extremely important to the future of Laredo. So making sure that these specific elements or topics are included into these assessments, so that way we're able to better develop and strategically place programs where they're needed in the community, or garner the support of our state and federal partners to make sure that dollars are free flowing into the City of Laredo based on the data, the need, the challenges that we are experiencing in the community. While the department has a number of programs and services already that are geared to maternal child health, there's still, as mentioned, through the reason for the assessments is just there's many gaps that we do see, gaps within care pre-birth, post-birth, and especially just being able to make sure that the baby has the best prognosis while also caring for mommy's physical and mental health is extremely important. And on the mental health side, Laredo is extremely underserved with our capacity to provide specialized psychiatric or psychological clinical services. We only have one psychiatrist in the City of Laredo. We're very fortunate for telehealth, which is able to provide those types of clinical feedback loops for mothers who might find it difficult, or when they're expecting a child, or the changes that are going to come. And we want to make sure that they are provided that not only physical health, but that mental health capacity as well.
That's fantastic. So you've had some successes. How do you plan to build on those successes looking into the future?
As mentioned, it's important for us to work going back to the core of it, is us working as a community. Mm-hmm. In order for us to elevate and advance, we need that unity in community to be able to make sure that we are tackling the public health challenges that we're experiencing overall, but specifically to this topic with mothers and pregnancy and post-pregnancy as well. And aside from the community element, we still have to make sure that our local government is very much aware of the investment that they can make into programs and services that are available at no or little cost to the members of our community. Aside from our local government officials, that takes us out into the state and to the federal realms, just to make sure that funding is available for these public health initiatives, because we've seen in the past that with different administrations, there tends to be cutting of funding for specific programs, and that just tends to unravel and unwind the 2 steps forward that we've taken, and then maybe sometimes it pushes us to take 2 steps back. So I would encourage that local leaders begin to put more funding from their general fund into local public health programs to make sure that they are sustainable and that they continue to work for the better of their communities.
That's fantastic. So if these leaders want to take action, where would they find more information, either online or through socials?
If these leaders wanted to take action, they can always just reach out to their local health department leadership. Their leadership will be able to guide them and advise them of programs that they have seen that have been beneficial to first-time mommies, for mommies to be, for mothers who already have children. That's where they'll get their information from the health departments to be able to drive those initiatives during their budget sessions, so that funding is deposited into those programs and cements them into the fabric of the local public health system.
Got it. Can they find more information on the City of Laredo website?
Yes. So you can find us at laredopublichealth.com, and there are a multitude of different services and programs that are available via our webpage. You can go ahead and cruise through all those different programs. And if you do have any questions, there is a contact us button, and that'll get directly to the specific individual of that realm that you're looking for. In this case, first-time mommies or mommies to be, or existing mommies, and that'll get to them. And if not, you can always get to me directly via that link as well.
Very good. Dr. Richard Chamberlain, thank you for talking about these programs with the City of Laredo Health Department. And if you would like, subscribe, or gather more information, just follow the links below.